Hello, this is REVOXYLIFE with Dr. EB. Welcome once again. As you may be aware, I have been discussing the side effects of radiation therapy on the skin, that is radiation dermatitis. And I discussed some of the specific subcategories of radiation dermatitis. The last was folliculitis. I discussed folliculitis and the agents used to address folliculitis. Today, I'd like to speak of the more common creams that are used to address skin side effects in general from radiation therapy, but more importantly, the other topical agents used that you may not be aware of. So the most common ones used are Eucerin and Aquaphor. Eucerin is spelled E-U-C-E-R-I-N, Aquaphor Aquaphor. And these two are recommended because they have the qualities that we need to address the side effects. And they contain certain agents that are active, and they do not contain agents that are undesirable, right? So those are the main reasons we recommend Aquaphor and Eucerin. But also they are available and affordable. So most of the pharmacies and stores carry Aquaphor and Eucerin, and they can also be provided as samples in the clinic. So that's the main reason we recommend those two creams. There are, however, other creams that can be used. And just like the palette or taste palettes, we prefer certain foods, and certain foods we do not. We like certain spices, certain drinks we prefer, some we do not. The same with the skin. So some of my patients are very selective, and they may not like to apply Eucerin or Aquaphor. There's some of my patients who are in Florida, for example, or in the Caribbean. They don't prefer Aquaphor because it's more greasy. Eucerin tends to be thick and lotion consistency. I think I mentioned this in one of my previous videos. But Eucerin may still not be desirable for some of my patients. They want something more maybe gel-like, but also effective, or a cream that is in between, that is not as greasy and not as lotion consistency like. And it's very difficult to mix Aquaphor and Eucerin. And so because I am aware that some of my patients are not too keen on the two common agents, I explore other agents. So one of those topical agents is, of course, Mioderm. Now, Mioderm has been used and provided in many clinics. It has all the attributes that we want in a cream being used for radiation dermatitis. So, of course, the creams need to be paraben-free, alcohol-free, and of course, fragrance-free. It needs to be hypoallergenic. So alcohol-free means that it won't dry the skin out. Radiation already causes dryness of the skin. So alcohol drying the skin out will cause a more accelerated desquamation, meaning skin peeling, which we do not want for any of our patients. So any cream that we recommend needs to, again, be paraffin-free, alcohol-free, fragrance-free, as in odorless, and of course, hypoallergenic. So if you find a cream over the counter that you think works well for your skin, you do not want to apply it. You want to take it into the office. I recommend that all my patients do so. They will literally purchase a container, a tube, or a jar. Or bring a sample in, and I will review all the ingredients, and then I will affirm if the patient can use the cream, or I will disappoint them by stating that this is not a cream that I recommend for their skin, but they know that I want what's best for them, so they will comply and to my recommendations. Now, there are other creams as well. There is a cream called My Girl. My Girl's for radiation dermatitis can be obtained over the counter. It has all the characteristics. Again, I'm sure you can repeat them by now. Maybe I will actually have a quiz session where I'll ask you for all the characteristics to see if you have been listening keenly, and maybe you will win a prize or two if you're able to answer correctly. So again, paraben-free, okay, alcohol-free, fragrance-free, of course, meaning odorless, and also helps to be hypoallergenic.